Brooklyn Independent Television.
Invasive meningococcal disease, IMD, is a very serious bacterial infection that can cause meningitis or blood poisoning. The rate of occurrence is low, but IMD can cause death if not treated in time. One of the groups most at risk is men having sex with men. And recently, a number of new cases have been reported within that population, especially in certain Brooklyn neighborhoods. The Department of Health and Mental Hygiene is determined to keep this outbreak under control. And two of its top experts are here to talk about the how and why of the disease and its treatment. Dr. Don Weiss is the Director of Surveillance for the department's Bureau of Communicable Disease, and Dr. Aletha Maybank is the Assistant Commissioner for the Brooklyn District Public Health Office. Thank you both for being here. Now, I have to, first question is, may I call you what I call you when I see you in the hall at work?
Absolutely.
Okay, Aletha, Don. Okay, so first, could you start by telling us what's going on?
Sure. When people think of an epidemic, they think of something like SARS or swine flu, hundreds of thousands of cases across the globe. But the number of cases we have now are much more than we would expect. We might expect, one case in a man who has sex with men, and we're, many times that, 20 times that now.
So anytime you have something that is far more cases than you would expect, that's your definition of an epidemic.
Yes. Right.
When did this epidemic start?
Well, we're tracing it back about 2 years, but it's really intensified over the last 4 or 5 months.
And when you say certain populations, could you explain who the certain population, MSM, anything else make you at risk?
Oh, HIV positive, and that may be either through the immune system being in decline or from particular exposures by behaviors. Now, this is a disease that normally affects the extremes of age, very young children and older adults. But we're seeing it in the prime of life, those individuals between the age of 20 and 50. So that's really why we're trying to get a message out that there's something they can do.
The other point is that where does meningococcal Neisseria meningitis come from? Where do they get it?
Yeah, so it's a family of bacteria that live in the oropharynx, in the nose and the throat. And most of the strains don't harm you, but there's a small group of strains that can invade. And that's what we're seeing, is that there's people that have this, they're transmitted to people who are susceptible, and those are the people that are getting sick.
Hence the name invasive meningococcal disease. Now, we say certain neighborhoods in Brooklyn are experiencing this epidemic. Where are they?
Well, most of the neighborhoods are in North and Central Brooklyn. So just to name a few, and there are about 8 or so neighborhoods, but there's Bed-Stuy, Brownsville, Bushwick, East New York, Crown Heights, Dumbo, downtown Brooklyn. I think that should cover it. And we have the list on our website. But we are having a lot of outreach and a lot of focus in those areas. And I do want to add, we're also focusing on men that we know have had intimate contact, which you can explain a little bit more, Don, but intimate contact at an online website or using a digital application, as well as going to a bar.
When you mentioned that people who had been online are at increased risk, could you clarify what that means exactly?
Sure. So there are many social networking sites and ways that people hook up and meet via an online vehicle, and also via a digital application vehicle. So those apps that we can download, there are many ways that people can hook up in that way, and they're at greater risk.
So intimate contact is something we definitely have to explain. How do people transmit it person to person?
Right, so it's a respiratory disease, so it's coming from the mouth in droplets. So that could be kissing, it could be sharing a cigarette or food together. It also can happen if you're in the prolonged space. So if you're sitting in a car with someone doing a cross-country travel, just breathing that same air for that many hours could put you exposed.
So when you're exposed, or you find out that somebody you were with has the disease, what do you do?
Well, at that point, we would offer you antibiotics, and then you take a single dose of antibiotics, and it'll get the organism rid it from your oropharynx. But the individuals that we're describing that are at risk, men who are having sex with men, meeting men online or at websites, they should get the vaccine, because there is a vaccine available to prevent this disease.
So how have you been getting the word out in these communities in specific and in general? What has been going on?
Many different levels of approach. So we have been releasing press releases. We did one back, I believe, in September, and now we did another one at the end of November. We have been working with a lot of online media that we know in which they have a larger audience of men who have sex with men. So some of relationships we have with that have been sending the message out there. We've been doing some feet on the ground, really outreach by going to meetings that are in our night shift communities and housing centers. We've been going to our community boards, some of our precinct council meetings of just really getting the word out there, handing out information, and telling people to make sure that even though they might not identify or know somebody specifically who is a man who has sex with men, to make sure that they just get the word out there. Because what we do know about this particular community, and that we know that there's a lot of stigma around whether it's HIV or having a conversation about men who have sex with men, and they might not identify as themselves. So we want to make sure that we just get that message out there that people need to get vaccinated.
Now, who's doing the vaccination?
Well, what we're recommending, one, they can find out, you can go to your health professional. So if you have a physician or any other health professional, you can ask them for the vaccine. You can also, if you don't have that, call 311 and they will be able to guide you in the direction. Then you can also refer to our website at www.nyc.gov/health. Now,
when you get the immunization, is it a one-time thing? Tell me what they need to do.
For men who have HIV, it's a 2-dose regimen. And I really want to emphasize that this is a devastating disease, and people should not take it lightly.
Yes.
You know, it starts as kind of like a flu-like illness, which at this time of the year you might mistake for flu. You'll have fever, and then you might get this really bad headache, and it can also come with a rash. People who get that should immediately see the physician, but we're trying to reach people before they get sick. And that's really the message here, is if you are in that at-risk population, go get the vaccine. It's a simple thing to do, and it'll avoid you and your family a lot of heartache.
You mentioned if you're HIV positive to get 2 vaccinations. What if you're a man who has sex with men and you just want to be on the safe side because you know you are prone to go online and so forth? What do? Do you tell them to get 1 vaccine? Or if you're a man who has sex with men and not in one of these neighborhoods, you need only 1, or do you need 2?
Well, because we're really focusing on the population at greatest risk, that's why we're targeting the MSM HIV. But if you meet some of the criteria, we'll recommend you just discuss it with your physician and make a decision together on whether or not you should be vaccinated.
It's very important that you tell one last thing about what to do if you have symptoms. Don't take aspirin and say, call your doctor in the morning.
No.
Yeah, you know, there's lots of very sad stories that we hear in investigating these cases. There was a case not that long ago of a young man in the prime of life who thought he would ride through those symptoms. And he was unfortunately found dead at home. So if you're having fever, and he was already recognized this was the worst illness he had ever had. He had talked to friends about that. So, you know, if you're really that sick, even before you get there, I think you need to seek medical care. At least speak to a physician, and they can advise you whether or not you need to come in or maybe go to the emergency department. Like I said, it's a devastating disease. You don't want to mess around with it.
The death rate is very high once you have it.
Yes, you know, normally death rates are way below 1%. This disease is almost 20% of those who get it die. So that's really high.
We're going to leave it at that. The message is get yourself to your primary care doctor. If you don't have one, call 311 or go on the website. Thank you both very much for being here.
You're welcome, Monica.
Watch this and other Brooklyn Independent Television episodes online at bricartsmedia.org/BIT.